بدأت مشكلتي في عام 2010 عندما تعرضت لوعكة صحية. على أثرها تم كشف وجود خلل في الصمام مع توسع في البطين الأيسر. وفي بداية عام 2013 بدأت أشعر بتدهور في صحتي غير مسبوق، يعني من قفلة وجهي وقعفة السبل. فالعلاج الوحيد زراعة القلب. قررت أن أجي للهند.
But after 2 years, he became severely breathless. So the Iraqi doctors told nothing can be done in Iraq. So he came to India.
He came to India with symptoms of difficulty in breathing even after walking a few steps, and palpitations. And after extensive investigation, it was found that he's suffering from severe heart failure due to a condition called dilated cardiomyopathy, where the pumping action of the heart is very poor. And in his case, compared to a normal of around 60%, the pumping efficiency was around 15%. And both the right and the left ventricle, both the right and left sides of the heart, in fact, were affected. And he also had significant leakage of the left-sided valve called the mitral valve. When we saw him, he was very sick and in fact developed what is called ventricular tachycardia and fibrillation, and at one point in time he required multiple shocks, as many as 15, to try over the night. So we discussed the possibilities with the patient. One was a transplantation of the heart. The other was an artificial heart pump. Our own preference was for a heart pump for two reasons. One is he's a young boy, and we felt that there is every possibility that if the heart is supported for some time, it might eventually recover so that he can get his own heart back.
So we decided to put a LVAD on these patients. LVADs are nothing but left ventricular assist devices. They pump the blood from the left ventricle to the systemic circulation. So we started on various medications to improve his cardiac output. It also improved his urine output. His symptoms became less. So we prepared him well. Then we took him for surgery.
And the surgery was carried out in the month of December, and we put in a pump called the HeartMate 2, which is the best FDA approved pump with the best long-term results in the world.
Now HeartMate 2 is a small pump which has got two portions. One is inflow cannula and the other side is the outflow cannula. This is the inflow cannula. This is the HeartMate 2 pump. This is the outflow graft. The outflow graft is sutured into the aorta. There is a percutaneous lead which comes out of the thoracic cavity through a small hole in the abdominal wall, and it is attached to the device.
And the surgery went off very well. He was taken off from the ventilator the next day, and he recovered rapidly. Now at the end of a month, he's able to climb 7 floors in this hospital effortlessly, and he's up and walking about, and he's ready to go back to his country and to lead a normal life. And unlike a transplant, very little medical therapy is needed. There are no drugs except for a blood thinner called warfarin, which is like for any other patient with a prosthetic valve replacement. No other complex medications are required. So we feel that managing him in another country would also be easy. And with this pump, he has the freedom to do pretty much what he wants. He can take part, he can run, he can climb, he can do anything you want except perhaps swimming. And we will evaluate him every 6 months, and we think that if with some luck, by the end of 2 years, if his own ventricle recovers, there's a possibility that the pump can be removed. If that happens, that would be in his best long-term interest.
وأنا الآن أعمل على هذا الجهاز وبصحة جيدة. فقد كان قبل العملية قلبي يضخ حوالي 2 لتر أو أقل من 2 لتر، وهو الآن يضخ حوالي 5 لتر. وعلى العموم أنا الآن بصحة جيدة، وأحسست أني الآن إنسان بشكل كامل وبقلب طبيعي، وهذا ذو فائدة كبيرة، وهذا أملي وهذه. وفي ختام كلامي أحب أن أقدم الشكر الجزيل إلى الدكتور بالا كريشنان وإلى الدكتور راو سوريش والكادر والأطباء الذين عملوا معهم والكادر التمريضي على رأسهم الممرض سوريش. وأشكر إدارة مستشفى فورتيس ملار على هذه الوقفة الإنسانية وتسهيل الجانب المادي، وشكرا.